Good morning. My name is Joe Holden. I'm an account manager at the Graham Company, a vice president as well. I've been with the Graham Company, which is headquartered in Philadelphia for going on now 17 years. We have our headquarters, as I mentioned, is in Philadelphia, but we have offices in the Washington, D.C. and the New York metro areas. I'm an attorney by training, and prior to joining Graham was a litigator with Drinker, Biddle and Reith, a national law firm. I was working on insurance and financial services matters. That's now known as Faegre Drinker, and we still work closely with them on insurance-related matters. At Graham, I manage a book of business that includes senior living, hospice, and home care operations. In addition to negotiating coverage terms and conditions for my client partners, I, along with my colleagues, also assist our clients with their risk management programs, including things like contractual risk management, fleet safety, and safe patient handling. I'm happy to be with you here today. The topic of our stand-up today is renewal, risk management, and insurance strategies to navigate the hard market. Before talking renewal strategy, I think it's important to spend some time talking about market conditions. Aging Services has been dealing with a hard insurance market for at least the past 5 years, which really began before the hardening of the broader market. When market conditions as a whole deteriorated, the senior living market only worsened. During this hard market, we've seen a number of historically strong players intentionally move out of the market entirely, while others move to the fringes. A few years ago, for example, CNA, one of the biggest players in this space, made a significant push for rate and in some cases retention increases. The hard market also saw CNA walking away from certain risks, either non-renewing them or effectively pricing itself off the risk. Last year, CNA moved out of the property space for healthcare risks. Some of you listening to this stand-up were likely impacted by that move. When we look at the broader market, not just in the aging services space, according to the Council of Insurance Agents and Brokers, property and casualty rates are up an average of 7.1% overall through the second quarter of 2022. That marked the 19th consecutive quarter with rate increases. With the exception of workers' compensation, rate increases have been seen on all lines of coverage. Certainly, some areas are hit harder than others. The cyber, umbrella, and property markets continue to see the largest increases. The umbrella market remains challenging as it continues to make corrections in an attempt to reverse unprofitability caused by things like social inflation and nuclear verdicts. Umbrella carriers today are being asked to pay claims on losses that never previously would have hit the umbrella coverage. When you think about the limit structure that's in place, generally, a lot of you probably have $1 million per occurrence on your general liability and professional liability with a $3 million ag, and your umbrella is sitting over that. That's been the pretty standard limit structure since the early to mid 80s, when relatively few claims went into the umbrella or excess layer. Fast forward to today with some of those conditions I mentioned, and we're seeing a lot more claims hit that umbrella market, which has put a lot of pricing on it. Now, no doubt though, while loss experience and claims activity is having an impact on the umbrella market, in my opinion, there's also been a lot of a money grab by the carriers, because some of these rate increases that have been pushed over the past couple of years have been exorbitant and I think unjustified. Thankfully, we are starting to see some more capacity in the marketplace. So that is helping to provide some more competitive alternatives. And while rates are still up, the trajectory is less of a shot to the moon than it was a year ago, and it's leveling off a little bit with that additional capacity in there. On the property side, inflation and commodity shortages are impacting the property insurance market. In addition to rate increases, carriers are now more consistently seeking increases in building valuations. The cyber market continues to see drastic changes in cyber insurance coverage placements. As the threat landscape has evolved, with ransomware attacks being one of the quickest ways for bad actors to monetize their efforts, the increase in frequency and severity of ransomware claims has become unsustainable, and the market is taking corrective action. The reality is, on the cyber side, we were in a bubble for a long time. Right? When I first got into this business 16 or 17 years ago, there were only a handful of carriers that were providing cyber coverage. Chubb and AIG were among the biggest. And it was not cheap back then. But in the intervening decade plus, the cost went down year after year after year. And as new entrants moved into that space, unfortunately, that bubble has burst and rates are going the other way. Terms and conditions are going the other way. And it's one of the hardest aspects of the market right now. According to the CIAB, so far in 2022, insureds are seeing increases of 50% or more, depending on the controls that you have in place. As you have no doubt experienced, the underwriting process has become a lot more stringent. Going forward, expect your cyber submission and loss control measures to be carefully scrutinized by your insurance company at renewal. In addition to stricter underwriting, carriers are also cutting limits as well as changing terms and conditions, including sublimiting things like ransomware coverage, one of the most important pieces of your cyber program. Today, there are signs that the senior living liability insurance market may be easing, as some new insurers have entered the space and some legacy carriers have become more aggressive in an effort to rebuild their books of business after balancing portfolios over the past couple of years. I already mentioned how the umbrella market, while still seeking increases, has started to level off a little bit. And whereas a couple of years ago, they were looking for 20 to 30%, they may now be starting at 10 to 15 and can be negotiated down from there. But there are definitely opportunities to find savings in the market. I talk about some of those legacy carriers getting back in the mix. CNA is a great example of that. A couple of years ago, a senior living provider reached out to us for help because it was surprised at the 11th hour by a significant rate increase from its broker and CNA, part of that reevaluation of the book I just talked about. In a compressed time frame, we were able to put together a competitive option that ultimately won the day. Fast forward to 2 years later, and last year CNA was back in the mix, pressing us to be able to provide an option. Ultimately, CNA put terms on the table that represented a rate reduction of more than 25%. Not wanting to lose the business, the incumbent, Berkshire Hathaway, provided even better terms. However, it wasn't until after Berkshire Hathaway initially indicated a 10% rate increase. So there are opportunities there to provide favorable renewals here to offset some of these large increases over the past couple of years. Of course, that's going to depend on your specific loss experience and the situation that you find yourself in, including, among other things, jurisdiction. Where are you located? Some states are definitely more challenging than others. So what can you do about it? What are those steps that you can take from an insurance and risk management standpoint to help put you in the best position forward for your renewal? Well, while it may feel like Groundhog Day, when your broker reaches out to you for insurance renewal information, now more than ever, it's important to get out in front of the renewal process. I know it's a burden. I know it's annoying. And believe me, if I could put a 3 or 5 year program in place for every one of my insureds, I would, for a couple of reasons. One, you wouldn't have to go through that process each year. And two, it would give you some pricing stability going forward. Unfortunately, those deals are very infrequent, especially in a hard market like we are in today. But if you're waiting until a month or two before your renewal to start focusing on it, you may find yourself up against some challenges, especially with respect to cyber. The insurance application and information gathering process is never a fun one, but putting the time in on the front end early will help put your broker in the best position to help you. So let's get a little more specific about that. What can you do? 5 to 6 months out from your renewal, you should be talking with your broker about your cyber hygiene and property program. With respect to cyber, taking a look at your controls in place. Do you have multi-factor authentication in place? And when we're talking about MFA, it's important to make a distinction here about what's going on in the market. Some carriers have taken a hard line on MFA. Travelers, for example, a year and a half ago said, if you don't have MFA, we don't care if we've underwritten you for 10 years, we're non-renewing you. Other carriers have been a little more lenient about it. If you're under 50 million in revenue, it's possible to find terms even if you don't have MFA fully implemented. Though you may get terms, those terms may not be as favorable if you do have MFA. Bottom line is having MFA fully implemented opens up options. However, if you're over 50 million in revenue and you do not have MFA fully implemented, meaning MFA for email access, remote access, and administrative access, you may find that you're going to have ransomware exclusions or sublimits. In addition, on the cyberspace, if you don't already have one, put an incident response plan in place. You could see, if you don't do that, you could see business interruption sublimits for your next renewal. So now is the time, 5 to 6 months out from renewal, ideally, if you don't have an incident response plan, put one in place. It's not something that takes a lot of time, but will go a long way with the insurance companies when they're evaluating your risk. In addition, on the cyber side, carriers are also focused on employee training and phishing testing. So if you're not doing this now is a good time to start putting something in place to set yourself up for the best renewal. Finally, one last point I'll make on the cyber is backups. Take a look at your backups. Are they redundant? Are they off-site? Are they encrypted? Are they tested? Get your IT folks engaged with your broker sooner rather than later. For our part, at Graham, we put together a cyber blueprint where we've consolidated all the most common questions from the various cyber applications, and make sure we get out way ahead of that with our clients. Make sure you're getting that from your broker. You're meeting with them early and getting that process started soon. With respect to property, take a good look at your property values. You can be sure that the carriers are going to be doing that. When's the last time you updated them? Since your carriers are going to be looking at them closely, you should be getting out ahead of it and doing it yourself. If you're like a lot of insureds, you may not even have any idea where those values originally came from, and they just get rolled over from year to year. Maybe you're bumping them up for inflation, but given everything that's gone on in the market over the past couple of years, certainly the inflation we've seen over the past year and the supply chain issues we've seen, this is becoming a hot topic for carriers. Property rates have been up considerably over the past few years, and while they're still up, now another channel for carriers to increase rate is by challenging those property values. And as your property values go up, the cost that you're going to be paying for that insurance coverage is going to go up. So there are things that you can do to make sure that you've got the proper valuation. Things like Marshall and Swift valuations. Work with your broker to take a look at the valuations for your properties. Especially if you've had some tough property renewals, talk with your broker about whether it might make sense to bring in a third-party engineer to inspect your locations. While there's a cost involved in doing so, this proactive approach may open up additional carrier options for you and help put your risk in a better light. It's one that we did with a senior living client of ours last year, leading up to their renewal, knowing that we had CNA on their property, knowing that CNA was moving out of the healthcare property market. We got that third-party engineer in on the front end early enough for them to get in there, inspect it, write their report, and then the client had enough time to address any of the issues that we knew would stand out and create a problem for the property carrier. By the time the property carrier sent their loss control engineers in, the client's property situation was tight, and we ended up getting a very good renewal for them. So make sure you're talking to your broker early about that. And if there is a situation where you think you can benefit from a third-party engineer, explore that option. It's also important on the property side to invest some time in completing the business interruption applications. The worst time to find out that you're underinsured is when you have a loss. 4 to 5 months out from renewal, meet with your broker to make sure they know all the wonderful things you're doing so they can help tell your story. Among other things, provide data about how you've improved staffing ratios since the difficult days of COVID, enhanced training, or raised occupancy levels. Those are things that can help make an underwriter more comfortable with your risk. Also, make sure your broker has your latest surveys and provide information on how you've addressed any issues that you may have noted in those surveys. Don't wait for your broker to ask for these things. Provide them in advance, be proactive about that, and that'll help smooth the process for you. Finally, take a look at your program structure. Does it make sense to look at different deductibles or a different program structure entirely? Maybe a high deductible program or a captive option. We're certainly having a lot more conversations with our clients these days about captive options as the market has continued to push for rate, and clients want to get more control over that. 3 to 4 months out from renewal, if you're considering changing carriers, ask your broker about the claims handling capacity of the markets in the mix. It's important to thoroughly investigate the carrier's platform to vet whether or not they have the necessary seasoned staff and expertise to help keep your claims costs down. How about year-round? What should you be doing? Contractual risk management. If you don't know the answer to these questions, it's worth taking a closer look at what you're doing from the contractual risk management side. Who's responsible for handling contracts for your organization? Is it centralized, or is it done individually at each facility? Do contracts renew from year to year with limited oversight? Talk with your broker about your contractual risk management. For some clients, I review insurance and indemnity provisions for 30+ contracts a year. For my contractor clients, even more. The devil is in the details in those agreements. And if you're relying on the contracts from your vendors or other providers, then you're not getting the most favorable terms that you should be getting. Take a look in particular at your technology and your labor staffing contracts. Those are ones we often get involved with. Technology contracts, we often find that they're looking to limit their liability to the cost of the contract. So in the event of a loss, you're really not going to have any protection in place there, and you're going to need to rely on your own insurance policy. Whenever possible, you want to transfer that risk to a third party to protect your loss experience. Because remember, the more losses you have on your loss experience, the more you're going to pay in insurance. And with respect to labor staffing contracts, labor staffing companies have gotten a lot more savvy in the past few years. Obviously, there's a higher demand for their services, and so getting the right terms is even harder than ever. But you want to make sure when you're looking at those contracts, you know what the insurance terms are, you know who's providing what. The labor staffing contractor is generally providing the work comp. You want to make sure you're getting added as an alternate employer on that coverage, and making sure you have the proper indemnification in place. Overall, the market remains challenging, but there are things you can and should do ahead of your renewal to get the best terms possible. And when I say that, when I talk about the best terms possible, I'm not just talking about price. Obviously, price is important, but a low price without the proper coverage to back it up is meaningless when you have a loss. So just an overview, high-level overview of some of the things that you could be doing in this hard market to best put yourself in position to have a favorable renewal this year or early next year. Thanks for your time today.